Kasey Frey, and today my guest is Dr. Laura Conway. Dr. Conway is an assistant professor and the assistant director of the genetic counseling program at Arcadia University in Glenside, Pennsylvania. Today we will be discussing the profession of genetic counseling and the role that a genetic counselor has in the healthcare delivery system. Welcome, Dr. Conway. Thank you for being here today.
Thank you for inviting me.
Okay, so to start off, could you please explain to us the medical field of genetic counseling, and could you tell us what is the role of a genetic counselor?
Sure. So genetic counseling is a field where we work with individuals and their families to help them understand the implications of genetic disease and help them adapt to it when it is has a psychosocial impact on their families.
Of course. So could you tell us what is the typical education that a genetic counselor receives?
Most genetic counseling students come into our program having a bachelor's degree in either biology or psychology or another area, but with a strong background in those fields. And then in our program, genetic counselors are in classes for 2 years. It's a 2-year master's program, and we have a lot of courses in counseling classes, counseling techniques, and then we also have courses in science and in medicine. So our education is quite broad so that people come out of our program with a good understanding of both the science of genetics and also an understanding of the counseling aspect.
Oh, okay. Sounds like a great program. So could you explain to us the working relationship between the physician and the genetic counselor?
Genetic counselors work very closely with physicians in most circumstances. In many cases, genetic counselors are actually employees within a physician's office. They typically work at least somewhat independently so that we have supervision from physicians, but then we also see patients on our own and educate patients on our own. In some cases, genetic counselors actually are able to work independently. It is within our scope of practice to be allowed to work on our own, although genetic counselors will always want to have access to physicians as referral sources so that we can send patients when they need medical decision-making and medical handling by the doctors.
Okay. So what are some of the most common genetic problems that genetic counselors are screening and counseling their patients for?
Genetic counselors work actually in a variety of areas. So we have the most common fields of practice are in pediatric genetics, where we work with families who have had children who are affected with a genetic condition. We also work in the prenatal genetics session, where we work with women who are expecting children and who have a family history of something that they're concerned about or who have test results that are concerning them. We also work in cancer genetics, where people have potentially a family history of cancer that they're concerned about. They want to find out if there are treatment or testing options to help evaluate their risk of developing cancer. Those are the major areas, and within those, many of the common conditions are things like cystic fibrosis or sickle cell disease, family histories of breast cancer or colon cancer. Those are a variety of some of the common things. We are actually moving into many other areas of medicine now. We're finding out that in many cases, things like genetics in cardiology is important. So there are people who have family histories of sudden cardiac death, for instance. Those are often genetic, where other family members could use testing and evaluation to determine their own risk.
Wow. Okay, so you mentioned cancer. Could you tell us what is the special role that a genetic counselor plays when caring for a cancer patient and their families?
Genetic counselors work very closely with people in that kind of a situation. When we're talking with people about their risk for developing cancer, perhaps for someone who has not yet developed cancer, we want to be sure that we're there to support them through the testing process. It's a very stressful situation, obviously, and helping them understand what the test results mean and what their implications are, both for positive results and also negative results. When you're concerned that your risk is very high and you find out the risk is not high, that can be a very shocking situation, and sometimes it takes time to adapt. In cases where people have a personal history of cancer, we can support them, again, sometimes in terms of treatment decisions or prevention following initial treatments. In breast cancer, for instance, we know that it is protective for people to have a prophylactic mastectomy or prophylactic oophorectomy to remove the ovaries in cases where they have known mutations in BRCA1 or BRCA2, for instance. Some of the genes that make your risk higher. And in those cases, we know that that can reduce their risk of developing a second cancer in the future. And then again, we can talk to them about the implications for their family members, whether their children are also at risk or their siblings or cousins. And so we're there to support them as they go through this process and understand what it means.
Yeah, absolutely. Okay, so I know that in recent years there have been many new advancements and developments for screening and testing for genetic problems. So could you tell us about some of those new advancements?
Sure. I think the most important one has been the development of the ability to sequence the entire human genome. So we have about 3 billion base pairs that make up the information you need to make a human, and we can now test that and identify those 3 billion base pairs at a cost of between $5,000 and $10,000. And the cost has been dropping very rapidly over the last few years. People are aiming for the $1,000 genome. The consequence of that has been that we can find a lot more. So in cases where we knew that someone had a condition that was running in the family, but we couldn't figure out exactly what it was, we now have a better ability to identify exactly what's going on. The downside of that is that we can identify so much that we're finding things we don't understand all the time. So we'll find gene changes. They might make a difference, they might not. It's very hard to sort out all of that information. So it's a very exciting time in genetics right now. It's also a very challenging time, and we're also trying to figure out some of the social implications. We can sequence genes in cases of disease. Some people are suggesting we do the sequencing in cases of healthy people to help them identify what they might be at risk for down the road. Our knowledge base is not quite where it needs to be yet in order to be able to do that, but it's advancing very, very quickly.
So is there anything that parents can do to change the genetic structure of their unborn child, or are there any procedures that can reverse an adverse genetic problem in a child once they're already born?
At this point, there's a lot of research going on in those areas, but there's very little that we can do to change the genetics. There are some clinical trials right now. The most successful one has been for a rare eye disease where people have actually been able to inject normal copies of the gene into people's eyes and restore some of their vision in a gene therapy trial. There are some gene therapy trials in other conditions that are being evaluated that are promising, although we're not quite there yet. That would be for people who are already born who have genetic conditions, and it would change their own genes but no one else's. I think one of the technology changes, again, that has happened really just over the last year or 2 years at the most, is that the researchers are developing the ability to change the genetics, say in a fertilized egg that then could be implanted into a woman in an IVF procedure, that would fix potentially a genetic disease, but would also fix that all of the cells in that child's body so that they would then pass that on to their own children. And as a society right now, we're struggling with the ethics of whether that would be acceptable to change not just the condition for that one person, but to potentially change future generations going forward. So I think we're again at a stage where our ability to do those things is advancing quickly, and one of the questions we have to answer is whether that's an event that society will accept before we pursue that.
Yeah. Well, thank you so much. We've certainly learned a lot about genetic counseling today.